how do you even have a review system? Like, how do you know that right now, if you have a Google review account, you've never operated on me, I can go and put a bad review just because I'm mad, because you did something. I don't like you. This thing is...
Yeah, and to your point, I mean, obviously it's a human nature. You're a lot more likely to leave a review if you're unhappy with something.
Exactly,
right?
100%.
So the people who are actually pissed about something, are unhappy, they're the ones who usually, go online and leave the reviews. The people who are happy, who have great outcomes, they say thank you and they tell you how much they appreciate you, and they rarely actually go an extra step to leave some reviews. But one of the interesting things you mentioned about this is that the doctors versus institutions versus the hospitals, right? Because very commonly we see and we hear people say, oh, this hospital is great, oh, this hospital sucks. Hospitals really don't mean anything.
They don't do the thing.
Hospitals are business organizations that are designed to generate revenue by providing care, right? And part of that structure is that they're supposed to have doctors and medical professionals within this organization to provide care, right? I can give you an example. So I train at Johns Hopkins. Johns Hopkins University is considered to be one of the best, if not the best, medical institution in the world, right? I train under some amazing doctors and great mentors. I can also tell that I interacted with some of the doctors, some of the surgeons at Johns Hopkins. I wouldn't let them touch my dog, but they're Johns Hopkins surgeons, Johns Hopkins doctors. So the fact that you have this name, the brand, the institution, doesn't really mean anything. It's about who are the specialists that provide care, who are actually, especially in the surgical field, right? Because surgical field is not just about assessing the patient, making the right diagnosis, which is hugely important, but it's about the technical aspect, how well you can perform the surgery, your technical skills, your education, your background, your abilities, your decision making, what kind of surgery to perform, and also how long it takes you to do the surgery.